Hi, Mama. Welcome back. I'm Dr. Emily, physician, mom, and your go-to guide through the incredible journey of pregnancy. Before we dive into today's topic, I want to let you know I've added a list of my favorite pregnancy-safe baby products and must-haves in the description below. These are items I personally recommend, and they can really help make your final weeks and the newborn stage a lot more comfortable. So definitely check them out after watching. Now, let's talk about something that can be confusing and sometimes even scary in the last few weeks of pregnancy. When your stomach starts to feel really tight and you get those dull, period-like cramps. It can be hard to tell what's normal, what's your body preparing for labor, and what might be something to keep an eye on. Let's break it down together. In the 8th and 9th month, it's extremely common to feel your belly tighten, sometimes randomly, sometimes frequently. That tightening feeling is often caused by what we call Braxton Hicks contractions. They're your uterus practicing for the real thing. You might feel a sudden hardness in your belly, maybe some discomfort, but it usually fades after a few seconds or minutes. These practice contractions can start earlier in pregnancy, but they tend to become more noticeable in the final weeks as your body gets closer to labor. What's important to know is that Braxton Hicks are usually irregular, don't last long, and don't get stronger over time. But what about the period-like cramps? Many women feel a dull, achy sensation low in their abdomen or back, similar to menstrual cramps. This can happen for a few reasons. First, your uterus is still growing and adjusting. Second, your baby might be dropping lower into your pelvis, getting ready for birth. And third, your cervix could be slowly beginning to soften and thin, which is a natural part of the body's preparation for labor. These sensations can come and go or stick around for a little while. And while they're usually normal, there are a few things I want you to watch out for. If the tightening or cramping becomes regular, like coming every 5 to 10 minutes, or starts increasing in intensity, it could be a sign that labor is beginning. If you notice any bleeding, fluid leakage, intense back pain, or the cramps become too painful to talk through, don't wait. Call your healthcare provider. And if you're not full term yet, before 37 weeks, it's even more important to get checked out, just in case it's preterm labor. Always trust your instincts, Mama. If something feels off, speak up. You know your body better than anyone. Now, if you're just experiencing regular tightness and cramping that doesn't follow a pattern, here's what you can do to feel better. First, hydrate. Dehydration is one of the most common triggers of Braxton Hicks contractions. Keep a water bottle with you and aim to sip throughout the day. Second, change positions. If you've been sitting for a while, try walking or doing some gentle stretching. If you've been on your feet all day, lie down and rest on your side. Warm baths or a heating pad on your lower back can also offer some relief. And don't underestimate the power of rest. Your body is working around the clock, and it's okay to slow down when you need to. Some women also find that deep breathing, prenatal yoga, or pelvic tilts help relieve tension and keep the body relaxed. If something doesn't feel good, don't push it. The goal is to keep your body calm and supported. If you've noticed that the tightness is happening more often, or the cramps are getting slightly stronger, that's not necessarily labor, but it's your body getting ready. Your uterus is toning. Your cervix may be softening. Your baby may be engaging lower into your pelvis. These are all signs that your body is doing what it's supposed to do. Some women experience this for weeks, while for others it's just days before delivery. I want to remind you that these symptoms don't mean your body is failing. They mean it's preparing. You're getting closer. You're doing beautifully. This is the moment when trust becomes really important. Trusting your body, trusting the process, and trusting that you'll know when the real moment comes. Before I wrap up, let me ask you, have you been feeling stomach tightness or cramping in these final weeks? What does it feel like for you? Share your experience in the comments. Your story might be exactly what another mama needs to hear today. And remember to check out the list of baby products and essentials I've included below. Whether you're putting together your hospital bag or organizing your nursery, those are my go-to items that make a real difference. You're doing an incredible job. You are so close. Keep listening to your body, take care of yourself, and I'll see you in the next video.